Good evening. Welcome to Hope for Healing. I'm your host, Dr. John Stracks. I'm joining you from my office here in Chicago. I'm a physician who focuses on the reduction and elimination of physical symptoms using mind-body medicine methods. If you'd like to learn more about my practice, I do practice telehealth, and my staff will be happy to talk with you. You can find more information about our services at www.drstracks.com. This Hope for Healing videocast series is one of many joint efforts between me and the folks at Curable. For those of you who are not yet Curable users, Curable is an amazing app that offers science-backed techniques for chronic pain recovery. We've been working together for about 6 years now, and we created this video series together because we want to help people in pain understand the connection between what's happening in their lives and what's happening in their bodies. Today, my guest is Dr. Lara Burke. Lara had a catastrophic medical injury when she was 16 years old, and then lived with debilitating and progressive chronic pain for almost 30 years before she found mind-body healing. And so she knows firsthand the profound healing power of mind-body medicine, even when one's pain is a complex combination of both structural and neuroplastic. Lara has now trained in pain reprocessing therapy, emotional awareness and expressiveness therapy, and mindfulness-based stress reduction, and is also one of the facilitators for the Curable groups. Today, Lara is going to share some of her healing story, as well as how to get the most out of being part of mind-body groups. Lara, I am thrilled for you to be here, and thanks so much for joining me on Hope for Healing.
I could not be happier to be here, Dr. Stracks. Thank you so much for having me.
You are welcome. I have talked to a lot of people in this format. I've talked to a lot of people in my office over the years who've had chronic pain, and yours is actually one of the more dramatic stories that I have heard over the 12 years that I've been in practice. And so let's start with you giving some of the background about what happened and what life was like for you for a long, long time.
Yeah, absolutely. So this all started when I was 16 years old, and out of the blue, I was a real sort of athlete type in high school, and playing soccer, lacrosse, basketball, running. I did a lot of running. I was training for soccer, and I was so excited. I just made the varsity soccer. And I was super excited about that. I'd been training and training and training, and I thought I had shin splints. And so I just kept training with that. And I think it was the very first soccer game that we played. It wasn't even official. It was just against another school, sort of a scrimmage. I developed later what I learned was acute exertional compartment syndrome in my right leg. And while I was playing, I just had a dropped foot, and I just was like, what is going on? And suddenly I had like the most unbelievable pain I've ever known, carried off the field, etc. We didn't know what it was at the time. They thought I was overreacting. I was writhing in pain. It was just crazy. And I went to the ER from there once they brought me home. But even on the soccer field, I should back up, even on the soccer field, my coach was like, stay in, like, because I was trying to come off the field because I was in so much pain. She was like, you can't, what are you doing? You got to stay on the field. And so that was kind of the culture and the mentality. And then, once I got to the ER, they said there's no breaks to the bone. Your pedal pulse is fine. You are being a crybaby. You got to go home. You're taking up space in the ER. And so they sent me home, and we had to come back. We came back again, and they again sent me home. And then in the middle of the night, my mom was lying next to me, and I was just like screaming, writhing. It was awful, in pain. And the doctor on call called us back, called my mother, and said, I think I figured out what it is. And he'd been a war surgeon, and he's like, I think I know what this is. You got to bring her back in immediately. So they figured it out. I had emergency surgery, and but they kind of didn't get it quite on time, and so I did lose a lot of that muscle in my right leg. And then there were some, difficulties where they thought that they were measuring the pressure in the leg. So the pressure in the compartments in the leg with syndrome go up really high when you have compartment syndrome and don't come down by themselves. So they thought they were measuring the pressure after the surgery, or a couple surgeries, but it turned out the pressure gauge was in the wrong place. And they didn't believe me. I was just in so much pain, so much pain, so much pain. And it was just like, no one believed me. Finally, a doctor came back in. He's like, oh, it's in the wrong place, jam. And it was awful. He put it in the right place and he's like, yep, emergency surgery again. So we went off to emergency surgery. And it was like that I was in the hospital for 6 weeks. I couldn't move. Like I had had so many surgeries and they were trying to save my leg. They told me that the only reason they did save my leg, because I was 16, I was pretty healthy otherwise. So it was quite traumatic. It was a very scary period. And to go from being an athlete to being just completely disabled overnight was jarring.
And so literally overnight, right? You were playing in a soccer game and then at 24, 48 hours later, you were having emergency surgery. And just for those who are listening, so essentially, if there are times when athletes can get a condition where the pressure inside the muscles, oftentimes in the legs, will go up too high and more or less cut off the blood flow.
That's exactly it.
Yeah,
Mhm.
and that's an emergency. And then what you're saying is that immediately, and so one of the things that you and I will hit on this evening is the role that trauma plays, and especially medical trauma. But from the very beginning, like literally from the very beginning, people didn't believe you and
That's right.
what was going on, which is, and
Mhm.
then that was costly in terms of how much time went by and what was going on inside your
Mhm.
life. Like makes me mad thinking about it. I wasn't even there. It's just 30,
Yeah.
35 years ago. And yet, and then I hear versions of this story from people over and
Mhm.
over
Mhm.
again. And and so how many surgeries did you have in that initial foray when you were in the hospital, you said, for 6 weeks when you were
I was in the
16?
hospital for 6 weeks, yeah, and I don't even remember, but I think it was something like four or five. And essentially because the pressure had gotten to such a point that they kept trying to relieve it in these sort of small ways. And then, in the end, they just had to it was, so it was a very, very large wound, and it was open for a year because it
Mm,
was so large. And I did lose a lot of that muscle. So in that leg, I did lose a lot of that. But, I was in the hospital for 6 weeks and, if it's funny, I remember like after they told me, we almost amputated, I was so shocked. I just I couldn't make sense of it. And there was a friend in the room at the time when the doctor came in and said that. The doctor's like, "You're a lucky girl. You're really lucky. We came within minutes of amputating, and you're just a lucky girl that we decided not to." And my friend, I'll call him Matt. My friend at the time, he was like, "Oh my God, I didn't know it was that serious."
mhm.
And I remember just trying to joke around with him, like, because I just needed comfort at that point. And he was like, "What did you do?" And I'm like, what do you mean? I was on the soccer field. I don't know. This is really rare. They told me it's really rare. It's like getting like the lottery, or I don't know, but a bad lottery." And he was like, "No, I'm serious. What did you do? You must have done something to deserve this."
Mhm.
And I remember he was so upset and he's like, think, you must have done something to deserve this. This kind of awful thing does not just happen to good people. And, I was 16, he was 17. We were young, but at the same time, it was I almost think that went into the pain. It was this social pain. It was so upsetting. So he left that day. Like, I remember the nurse came in and said, "Matt, honey, we're going to have to ask you to leave for a minute. We have to do a dressing change. She's going to be in pain. So she's going to want you to come back and talk to her afterwards. So if you could just wait outside for a minute." And I saw him leave and he never came back. And he actually never spoke to me again. and it was really upsetting. And it was one of those things like I credit it. I became a sociologist and I credit it to that because I just spent so much time like, what was it? Like, I don't understand. It took me a long time to kind of wrap my head around. And eventually I was like, you know what? Like, I think he needed to believe that there was some logic to all of this, that he could avoid it. You know, there was a predictability and logic, maybe like if you play your cards right and you're a good person, you can avoid stuff like this. But obviously, that's not how the world works.
There's so much of that out there, and even today, my daughter, who's 18, was telling me that they had a meeting about COVID and said they weren't going to offer any kind of remote learning if you got COVID because they said it was on the children's responsibility to keep from getting COVID. Like it's still this
Oh,
idea that like if people are sick, if people are in pain, it's your fault, and we spend so much time trying to combat that, and yet it's
for
so
sure.
ingrained in society that like you must have done something
Absolutely.
really bad to get that outcome.
Hmm.
Um, and so that was just the beginning, and there's a lot
Yeah.
more to your story. And so that was when you were 16. And so walk us through kind of
Yeah.
what happened from there.
So, so I want to tell a tiny story from the hospital to sort of set the scene for the rest. I remember my mom and I are really, really close, and she helped me through all of this. I could not have done it without her, literally. So she and it was in the aftermath of like one of the emergency surgeries, and it was like bad news. It was always bad news, you know, and I was kind of processing like, oh my God, I still might lose my leg. And they said it could happen in the other, and ultimately it did happen in the other leg. I could lose both my legs. And she got in those, you know, the hospital bed goes up and down, like, you know, like it's like Crop-O-Matic 2 adjustable bed type of thing. And so I was in this bed. She got in next to me, and we just rode up and down on that hospital bed while I was just processing, like, if I lose my legs, who would I be? Like I was an athlete like a couple weeks ago. Who would I be? Like who am I if I lose that? If I lose and I just remember like just really processing like who would I be? Like who am I? And I think that sort of set the stage for all of the processing that I did internally afterwards. That and the sort of social aspects of this chronic pain experience. So essentially, after that whole, you know, original emergency, it basically became chronic. After, well, it happened once I was up. I was on in a wheelchair and on crutches for a year or so, and once I was up onto the crutches, it happened in my other leg because my other leg was sort of bearing the brunt, right? So that was terrifying and just so it was a lot of trauma, a lot of medical trauma, just very, very scary stuff. And then from there, it just like I kept having surgeries. And they're like, well, you know what we got to do? We got to go in and we got to like deal with the compartments. And so it was just a lot of surgeries, and it interrupted my high school experience and my college experience and all those things. So fast forward, I think
And
probably,
just
yeah.
one question about that is, so you talked about that experience with Matt and he never showed up again. Do you remember like what the response was of the people around you? And so, same thing, right? You're an athlete and 16 years old, and then you show back up at school on crutches or in a wheelchair. And did my imagination is that some people probably rallied and were good about it, and other people probably disappeared, but it must have been super jarring
It
and
was.
disorienting, I would think.
It was, and I went to a very small private high school, and it was after ADA had been passed, but they were not yet compliant. And since I was in a wheelchair, I basically had to be in the infirmary all the time because they didn't have a ramp and they didn't have any kind of there were stairs everywhere. So like, I had to go through this ritual every morning with my mom where I had to like literally sit up my butt on the stairs and like get myself up the stairs on my butt, basically, like while my mom held my leg and get into the infirmary. And I remember this like these boys were driving past at one point and they yelled cripple, and laughed and drove away. So that was like that kind of sums up a lot of what the high school experience was like. It was really tough. It was really tough. Yeah.
And so then as years went by, you still, I mean, you still dealt with college and beyond. And so keep going with the
Yeah.
story and keep I want to hear more about how this evolved over time.
Yeah, so you would think it was sort of just my legs, but over time, I think it just, I think, like, I always thought of it like my body had PTSD, not just me. And I really felt that way because it would just be one kind of thing after another. Like, who gets mono for a whole year? I do, apparently. Who gets, like IBS, TMJ, mast cell activation disorder, exercise-induced histamine, blah, blah, blah. It was just like one thing after another. So that was sort of like dotted throughout my college experience. I had to take a year off college because of the mono and the all the illness. And then after that, I did develop chronic fatigue syndrome and, the chronic pain syndrome. They didn't know what to call it at the time. And it was so sort of systemic at that point, and I had to take a year off of work. I mean, there were just a lot of interruptions. And so, I mean, thinking back to that time when I rode up and down that in that bed with my mom, like, who am I if I lose this or that? I think I kind of like, it was like I became an observer or something. I became like the person who tried to figure stuff out, like I was the person who tried to make meaning of all of it, like figure out sort of the story of it. So there was a lot of rupture to my life. It was not sort of a coherent timeline like it is for a lot of people going to high school and then college and then, so there was a lot of rupture, and I just kept having things like that, and it was very traumatic in that way too, because it was just like you're going along in life, and then the other shoe drops right again, and
Right.
so yeah, there was a lot of that.
For decades. And then
Decades.
part of your journey is that you got through college, you went to grad school, you got a PhD, correct, in
That's correct.
sociology, partly I think because of your
Yes.
experiences, correct?
Absolutely. Yeah. Yeah. I focused in the sociology of, essentially of chronic pain. I thought a lot about sort of pain as almost this like somaticization of alienation or marginalization, where it's sort of like it can get into your body, that kind of hurt, that kind of alienation. It really just, so I became, yeah, a sociologist. I really was interested in like what happens when people are just cut off from the social group.
Mhm. And so about 2.5 years ago is when you first found out about mind body medicine. And so leading up to that time, that had been probably close to 2 or 3 decades after the original injury. Where were you right before you made that discovery? And then how did you go about learning
Mm.
about mind body medicine?
I was at rock bottom. I'm not gonna lie. I'd had my 16th surgery on Christmas Eve. I always forget what year that was because it was such a blur. And I was just at rock bottom because the surgery was supposed to make it better, and it was in my left leg at this point and behind my knee, blah, blah, blah. It was just supposed to make it better, and I was just miserable. And the surgery actually made it worse. And so it was at this point, and I know I hear this from curable groups members all the time. It's sort of like that you get to that place where you're so desperate, you're like, I don't know, I'll try anything. And that's when I came across, I was on Facebook and I actually seen curable ads before. And it sort of, they'd popped up here and there, and I was sort of like, didn't really register. But at a certain point, it's like I looked at it and I saw a testimonial and I was like, you know what? Let's try it. I'm ready. I am ready. I will try anything. Yeah. So that's how I found it.
And then what spoke to you about it? What made you look at it and not just throw it away and go on to something else? What made you pause and say, like, huh, I wonder if this applies for me?
It was the story. I remember reading, it was just a testimonial. It was like this woman talking, and I just resonated like with what she said. And I thought, you know, maybe, let's see. Because at first I thought, like, how could that possibly work? Like, and but something about her story felt like I just resonated with it. And I thought, you know what? Let's just give it a try.
Yeah. And then what'd you do? How did you give it a try, and what did you learn, and how did things evolve from there?
Yeah, so I started with the app, and it was interesting because at the time I was like, I downloaded the app like immediately. And, like a lot of people I hear about will go through the app voraciously. Like, it's sort of a little bit of less is more. But for me, I was like, okay, let me just consume it all now. And it was such a turning point because it was like learning about the pain science was such a turning point. The education there was therapeutic in itself, just this idea, because it resonated. I was like, oh, right, I've been saying this for years, like my body has PTSD, and actually that's kind of what's happening. Oh, that makes sense. And it was validating. It was just like finally someone understands. I felt validated. I felt like someone out there gets what's going on with me and they don't just think it's all in your head and you're just making it all up or you're being whatever. I felt so validated almost immediately just by learning about the science of it. And from there, I tried graded exposure,
Mhm.
and that was what really did it because I was unable to walk. Like I couldn't even really get from my couch to my freezer to get more ice. I was on crutches, and it was just 9 out of 10 pain all the time, and it was like, what have I got to lose? So I remember like learning about graded exposure on the app, and I was like, I'll give this a try, and it's like if walking a little bit doesn't increase your pain, like why not do that? And I was like, okay, sign me up. So I did that, and it didn't increase my pain. So I thought, like, okay, I'll try a little bit more. Got to the mailbox, in the building, and then I was like, well, maybe I can get past the mailbox next time. So it kind of went on like that. And then I was like, maybe I can get outside. Maybe I can get to the end of this little block, and it just kept progressing. And I was like, it was so empowering. It was like, oh my God. Yeah, so that's how it started.
And so, a couple things about that. Number one, it's amazing how often people need to get outside the medical system to get the validation.
Yes.
And so, you knew about all these things, and yet being in the medical system, it's hard to find somebody who can say to you, like, yes, of course, your body has PTSD from all of
Hmm.
this. And so many messages within the medical system that you're not experiencing what you're
Right.
experiencing. And so it's to your credit that you were able to hold on to that and know that it was true, even when people tell you the opposite.
I just have to give credit to my family for that because honestly, I lost track of it sometimes. They always were by my side. And I think that's what really saved me because the medical establishment really sort of saw me as the patient who, like, the hot potato and the person they didn't really believe, which was so hard. It was so hard to live with that kind of how people see you. That it's that sort of, yeah, looking glass self, they call it in sociology, where like you sort of see yourself as you imagine someone else sees you. And always getting that back from the medical establishment felt like I had no credibility. It felt a little like gaslighting. It was sort of like my reality, I was being told constantly, was not actually my reality. And to have my family by my side and just always believing me, I think that's what helped me get to the point where I could find curable.
Yeah, yeah, and one of the things, in addition to trying to get this information out to patients, we're working hard to try to get the information out to clinicians too, because how much a different experience would it be for everybody if clinicians and medical professionals were consistently supportive,
Yeah.
encouraging,
Yes.
validating,
Oh my gosh.
kind even.
Yes. I
and
know.
and so, that's the ultimate goal too, is to be able to for people to have those experiences as they're being
Mhm.
treated and as they're learning about this.
Can I
and,
say
and
one? Oh,
go
I'm
ahead. Yeah,
sorry.
please
I
go
was just
ahead.
going to say one thing about that. The sort of Western medical establishment as well was very like compartmentalizing, which is sort of ironic, the compartment. But it was a little bit like I literally like went in one time and one doctor, I was going in for my right leg, but my left leg was starting to go acute, and he's like, "But that's Doctor so-and-so's leg. I can't see you for
Seriously?
that. Seriously, he wouldn't see me for it because he was my right leg doctor and not my left leg doctor. And I was like, oh, okay. And I was just so beaten down by that point. I was like, okay, all right, I guess I have to go to the other emergency room then. Yeah. So,
It's an insane story. And um, we were talking earlier today, just in on my team, um, that one of my patients was, this is a very tangential, but one of my patients was diagnosed with celiac disease recently. And so I met with her and we talked about it. And I asked if she wanted a referral to the celiac disease experts here in Chicago. And she's like, oh, like, all my friends have it. I think I have all the information that I need. And so sociologically, it's interesting as people are starting to take their healthcare outside the system because the system has failed in that way, and the incredible knowledge that has accumulated amongst people actually dealing with the diseases. And the medical system is not ready to deal with that dynamic, but that dynamic clearly is already there. And so, what I say frequently about Curable is that millions, it's been downloaded millions of times. And so there are millions of people around the world working together to figure out how to solve this. And it's not the way we think of the medical system, but way more effective.
absolutely. It's that I think is one of the things that was so healing to me. It was just like I had spent so many years feeling like nobody believed me, nobody got it, nobody understood, nobody wanted to listen, nobody validated anything about it. So I just spent a lot of time imagining what I looked, because it was invisible, that at a certain point the disability was invisible. And when it's invisible, I think people are more likely. I got often like, well, you look fine. Like, why can't you do this thing? So I would try to rise to the occasion of what it looked like I could do. So to come to a place, to a community where it was like, not only was the science there to validate, but people, there were just loads of people. And I was like, really? There are other people out there? This is amazing. And
Yeah.
it just, and so of course I signed up for curable groups because I was like, okay, I want to meet these other people.
Yeah.
um, yeah.
And so you did the Curable groups as a participant. That's where you and I think, crossed paths for the first time.
Oh, yes.
And so what was that experience like, being in the group and yeah, and hearing me and some other clinicians talk? Well, how did that help propel you forward?
It was amazing. I think, and I'm still, we call ourselves the Pit Crew, my curable group, my original curable group. We still meet all the time. We're still, we're really good friends and supports to one another. And so when I met all of them, it was just sort of like this, wow, I don't have to explain myself. Like, I don't have to describe or explain or justify. I can just be. I can just listen to people's stories. They can be there for me. And it was really powerful. It felt like they were, I feel like in groups you're like this like mirror for one another. And it was like we could mirror for each other the insights that the person themselves can't necessarily see, like they'll, or the growth, or they will not necessarily see it themselves, and yet like people will reflect back, like, do you hear how much, how differently you're approaching this thing? Like, that is amazing. And it's like, oh my gosh, yeah, it is. You're right, I didn't think of that. And there's something just profoundly healing about that itself, because it's at least for me, the experience of chronic pain was so deeply isolating and so deeply alienating, and there were just so few words, so little community, and suddenly there's this group that understands and they get it, and you don't have to explain. And there's just something very healing about that fundamental like alienation of the pain, and it was incredible. And yeah, I
Yeah.
don't know what else to say. It was amazing. And I want to
Yeah,
speak to
just
what you
you can
said
get it
too.
right, and you can get into a group of people where you can say that you've got an injury in your right leg and somehow it's in your jaw, and people not say, well, that's impossible, or
Exactly.
anything else. Everybody's had that experience or versions of those experiences.
Yeah.
And so, as part of curable groups, I'm oftentimes there answering questions during, one time during the 12 weeks. And so like I said, that's where you and I cross paths. And so I think at that point, like you were still wondering, okay, you've had this injury, like a
Yeah.
clear medical injury, 16 surgeries, you're working on this in a non-physical way. And so I think you asked me that question, like,
Mm.
are you in the right a version of, are you in the right place? Can this be helpful for you since you've had these physical issues?
Yeah.
And I think I probably gave you the answer that I generally give when somebody asks me that question, which is
Hmm.
there's always physical components to pain and psychological components and emotional components. And we oftentimes, until we learn differently, we assume that the physical component is the whole story. So we assume it's 100% physical until we learn differently. Once we learn that there are other aspects, we don't know a third, a third, a third, or 2%, 2%, 96%. And so what I probably said was, say it's 50-50. If
Hmm.
you could be 50% better than you are, then would that be worth it to you? And what I probably said was, and once people start working in that direction, oftentimes it's much more than 50%,
Yeah.
turns out, is
Hmm.
non-physical. So start and get going and don't put limits on how far
Yeah.
you think you can go. And when we talked about it afterwards, I think you really took that to heart.
That was a turning point because I was so stuck on that question of structural, not structural. It's going to work for everyone but me. So you, exactly as you said, I asked a version of that question that I hear all the time, and it just your answer really opened the door for me because you were modeling curiosity and you were modeling compassion and you were sort of saying like, do the work, see how far you can get. You never know. And it was like, good point. Maybe I should just do the work and see how far I can get. And that's what I did, and that opened the door for me. I was able to, I felt like I was a dog with a bone. Like I didn't want to let go of that question. And then once you said that, I was like, oh, I don't have to wrestle with that question. I can put that down. I can do the work and see what happens. And
Mhm.
that's what I did.
Yeah. And
So
so then what
thank you.
happened? Yeah, absolutely. I mean, it's totally my pleasure. Um, and what happened from there? So that was probably a couple of years ago.
Mhm.
And what have you learned and done and experienced since then?
Yeah, I really was open to the work at that point, and I mean, I was sort of tentatively trying it, and then after that, I realized, like, you know what, I'm diving in, I'm doing this, and so I think, one of the biggest things was the graded exposure, outcome independence. Those were some of the biggest tools that I kind of took, but it was also this sort of empowerment, like the whole thing was so empowering. It was just, I don't know, like even if I was in terrible pain, like I remember like one time I was sort of like in this horrible pain flare, which happens, right? Like it's nonlinear. And I was like on the bathroom floor. I was in so much pain and I was like, you know what? My bathroom cupboard is so disordered right now and like I'm on the floor anyway. I might as well like clean my cupboard. So I did. And it made me feel so much better. I was like, still had the pain or whatever, but I was like, but no, it looks all orderly. This is great. I've been meaning to do this for a while. And that to me just sort of like encapsulated something Curable gave to me, which was this sort of like agency, like taking, like, I don't know how to, it's just like this taking my power back and finding joy in things and being present. And I think all of those things plus self-compassion, that was a huge piece for me because oh my gosh, we can be so mean to ourselves. And I think honestly that's probably the biggest thing is that the self-compassion, becoming a friend to oneself rather than this internal enemy, which is definitely what I was without even realizing it.
Yeah.
And that's a skill you can work on, and I'm still working on it, believe me, gosh. But that has really, really changed my life.
Yeah. And so what are things like for you now, a couple of years into this? How have things changed since 3 years ago? What's your life like these days?
It's amazing. Like I can do so many things. Like I've been jogging. Like they told me I'd never walk normally or walk potentially again, and I can jog. Um, I'm not without pain. I have some because I have this sort of, there is some structural stuff there that sort of, it's a baseline. But compared to what it was, it's just remarkable to me. And what I notice is that I not only have my life back, I have my life back far better than I ever could have imagined it. I feel like I have become really who I am through this work. And I feel like getting myself back, and then some has been extraordinary. So to me, I feel like we can get caught up on these questions of structural and not structural. We can get caught up on questions of like, how much pain, and I just feel like this has just transformed my entire focus. Like I don't focus on pain anymore. My focus is really about joy and meaning and, you know, helping others and things like that. It's sort of focused on that different direction.
Yeah. And so just to be clear, we've been talking about 16 surgeries, almost an amputation of your leg. And so clearly structural issues that are there. But despite that, this work, I think you would say this work has been life-changing
Yes,
for you.
just completely and fundamentally life changing. Absolutely. I just feel like I have been just, yeah, I can't even really put words on it. It's something very empowering about it. There's something, I don't know, it gives you this sort of sense of peace because even life is going to throw us lots of things, always. That's just what life does. And it gives tools for handling that. So it made me feel like, okay, I'm not a victim. Like, whatever happens, I have some choices, I have some tools, I can handle it. And that has really been a fundamental shift for me, to have that sort of agency and empowerment back.
Yeah. And and I don't think you would say, like, if I asked you, like, you're 100% cured, do you have no pain? I don't think the answer to that would be yes, correct?
Yeah, but I do feel like, yeah, that is right. I still have some pain. It's nothing like it was, and I can do all kinds of things in spite of everything. But I wouldn't say, yeah, it's not 100% gone, but I feel like I am 100% healed. I don't know if that makes sense, but to me, like I think sometimes about that Japanese tradition of kintsugi, I think it's called, of repairing broken bowls with like gold, and sort of like that suturing of broken places with gold. And I feel like that process has has healed me.
Yeah.
And so to me, that's more important.
and and to try to connect the various edges of the story, when it first happened, that was the question, right? You were an athlete, that was who you were, and so you weren't anymore after you were injured, and so you had that question, who are you now?
Yeah,
And I think what you just said is that the answer to that did not turn out to be you are pain, or you are somebody with pain,
that's
or
right.
you're who deals with pain. And so the answer to that has become very different.
Mhm. Absolutely.
And it's
Yeah,
um,
yeah.
any additional thoughts? So, lots of people who are listening have structural issues, have been struggling with, feeling like they're on the right track, but still some things that hold them back. So, any direct thoughts, for people who clearly have structural issues that they're dealing with and yet are listening to us at the moment?
Absolutely. I think you can get stuck on that question of is this structural or not, and thinking in that kind of binary way. And I would just say, what you said to me, Dr. Stracks, I just feel like if people could really embrace, like, just do the work, get curious, see what happens. You never know. And it's oftentimes far more neuroplastic than we ever would have imagined. And so, why not set that question aside and give yourself the gift of trying? And you'll be surprised how far you can get.
Yeah. And what about for people who feel like they're making progress, but still there's still pain or there's still symptoms? Any thoughts about how to leave this idea that like we're 100% better or we're not
Hmm.
better?
Yeah, I really feel like there's a way in which you can become sort of a friend to yourself, that there are opportunities in flares or opportunities in whatever comes up for people that kind of are a place to show you, I can handle this differently now. Like I can respond to this thing differently. And having that agency and that empowerment and those tools, I think can help people begin to shift their focus from those questions of pain and structural versus not and all those things to really like, what do I want out of my life? Like, what brings me joy? What gives me a sense of like giving back to the world? What is my purpose? Like, I want to focus on those things. And I feel like sometimes like giving up those other questions can enable you to go into this like new way of living.
Right, because if the focus for you for such a long time was on the pain, like that's sort of how do I get rid of this? What do I do about it? What needs
Mhm.
to happen next? And what you're saying is that even when the pain is there these days, it's not the focus, or it's just a clue or a little bit whisper or a guide, but you don't focus on pain as the problem.
Right.
I think
Like
it's
I remember going through groups, and there was something about I think this is in the Curable app as well, but like being grateful for your pain. And I remember at the time being like, "Oh my God, I am not grateful for this." Um, but it's weird. I am now. I really am. Genuinely, truly, and honestly am grateful because I would. There's a quote that I love. I actually haven't read the book. I shouldn't say that, but one of my curable groups members shared this quote, and I just love it. I am better off healed than I ever was unbroken, and I love that. I just think it is so true. Beth Moore, I believe. Yeah,
say it again. I'm better off. Say it
I
again.
am. I am better off healed than I ever was unbroken.
Yeah, yeah, which is amazing. Um, the just a quick question about the trauma of all of this. And so lots of people who are listening have had traumatic events happen to them over the course of your life. A lot of yours was this medical trauma starting from the very first day. Like, don't come out of the game. This is,
Hmm.
get back out there. And was there anything in particular that you felt like you needed to do to heal that aspect of being not believed, and all the times people have cut into you for surgeries and everything else? Was there anything specifically that you had to work on?
Honestly, I think it was the groups. Um, because so like I said, it was so alienating. I felt like I had no voice. I felt like even if I tried to use my voice, no one believed me. All of those things. And that was probably the deepest trauma of all. And groups kind of heals that fundamental trauma for me. And it was just a play, like again, and it's not, and it now goes beyond groups because now I lead groups, which is amazing because you can kind of see people through this journey that I have gone through as well. And just like it's different for everyone, of course, but I learned something every time from all of the people going through. And I don't know, there's something really profoundly healing about sharing that,
Mhm.
being witness to others and really being a part of this. It makes me feel whole. Like it sounds cheesy, but I feel like there was so much time I spent on the outskirts of life or on the outside or the margins of groups of others. And now I'm like, it's like, I don't know, I just feel like I have found a place where I can heal that fundamental wound and really just begin to like, you know, give back and like live, like move on, you know.
Yeah. When I worked at the in the hospital system here in Chicago, there was I got to do a little bit of teaching of medical students, and so taught a course on healing for a number of years, and it's a 5-week course, 2.5 hours each week, and we spent 2 of those weeks on what grieving was, and so we would have the students tell a story themselves about something that they had lost. It could be anywhere from, a backpack to a person and anywhere in between, and taught them that grieving was really about sort of how we heal loss, and we do it in community, and we do it by telling stories with others who will listen. And so groups gives people the chance to tell the story, and b, in a community of people who can hear that and offer support. And there just aren't that many places these days
Yeah.
where that is possible.
Yeah, absolutely. Yeah, and there's something really beautiful about seeing people be mirrors for one another in the group setting, but also being models for like compassion because it's so hard. We are not taught compassion, self-compassion, I mean, and it is so hard, and it's just something that you have to see and learn and practice and internalize. And one thing I think groups gives people is it's like everyone else in the group can give a person compassion. And then over time, I feel like I see people internalize that and be like, oh my gosh, yeah, they would tell me blah, 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 blah. I can now hear that in my own self when I'm in my life, going about my day. And you see the power of that, like people being able to model those things for each other.
And so many, in contrast, substantially with the outside world, so many opportunities to criticize ourselves, whether we're comparing ourselves to people on social media or getting lousy feedback in our workplace, or just all the areas where it's so easy to pile on, and the contrast of hearing other people and then ultimately ourselves give us encouragement and kindness and patience.
Yeah,
And
absolutely.
and so you've done the groups both as a participant and now as a leader. For people who are thinking about joining a group or in groups, any thoughts about what helps people get the most out of the experience?
Absolutely. I would go back to, again, your words. And actually, more recently, you said something. I'm gonna get, I had it written down because I love it so much. Um, like people get caught up on like how much they need to believe or not. Like if they have doubt, maybe they can't do it and all that stuff. And I just would encourage people to set that question aside too, because you can be a little bit like a dog with a bone with that question. And something you said in a recent group was, it's not about belief, it's science. Do the work, see how far you can get. And I would just encourage everybody to try to set aside those places where you can get stuck and really open yourself to the experience and see, like embody curiosity and compassion and see how far you can get. Like just let yourself go as far as you can go. And I think people will be surprised.
Mhm.
Yeah.
Yeah, I'm part of an email network amongst practitioners in this field, and we were talking about COVID long haul, and I've seen a number of patients with COVID long haul sort of and explored it from this aspect. And so I was saying that, and somebody quoted Deepak Chopra saying something to the effect of illness is the West's way of meditating. Um, which
Wow.
I really like, right? We live in a society that says go, 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 go.
Yeah.
When as human beings, we need opportunities to take a step back, to reflect, to learn.
Mhm.
And and if we don't do that, ultimately our bodies will ask us to do it.
Absolutely.
for us. And so, so we, there's so much pressure, like what did you do to deserve this? What do we all need that we're not getting? And at what point does our body say like, hey, I'm going to make you sit
Hmm.
down and take a look at this?
Exactly. Yeah, it's a little bit like, okay, everybody needs a timeout. Absolutely. And if you think about like, um, I think of the analogy of like fields that need to be fallow in order to thrive again. And we do need rest. And sometimes rest is almost like a like anti-capitalist,
Mhm.
it's resistance to the whole, system, the whole, all of it. And so I think it's scary for people to enter that space. And it helps when there are others there with them and to say that it's okay. This is actually part of being human, this
Yes,
rest, this
right.
reflection.
Yes, and that big pivot that people start to make as they spend time in this world from looking at their body as the enemy.
Yeah.
I have been betrayed. I have been let down. My body is keeping me from where I need to go, to looking at our bodies as our allies that speak up for us and stick up for us and have um, and know what's best for us in ways that sometimes, even if our brain says, no, 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 I know what's best, sometimes our brains just don't. And so as we learn to listen to our bodies, be curious, slow down, understand that maybe we don't know the whole picture, that's
Mhm.
when people really start to heal.
Yeah, absolutely. Absolutely. It's really incredible.
So we've come to the end of our time for this evening. Anything else that you'd like to share with people who are listening, struggling, in process, just getting started? Anything else you'd like people to know?
I would just say give it a try. It is worth everything. And it is one of those things that it's a mindset shift. And if you can kind of just go with it and allow yourself to see how far you can get, you really can be surprised. And I also want to just give gratitude for, I have so much gratitude for Curable, for you, Dr. Stracks, for the role that you played in that turning point for me. My group, my pit crew, like all of my groups, like I feel like I have learned so much, and I am so grateful to be able to continue learning all the time from people who are being so courageous. And just allow, I would just say to people, like, allow yourself to just step out of that old identity and see how courageous you can be.
Yeah. Thank you so much for being here and sharing your experience and being open and sharing your knowledge and your wisdom. I know how much, and you know how much that's helpful to be able when you're just starting to hear other people who have been walking through that journey. So thank you for being here with us this evening. And thank you to everybody else who's been out and listening. And each time we do this, I'm reminded how lucky I am to be part of this brave and creative community of people who are going about healing in what is really oftentimes a countercultural way. Um, as we wind up this evening, as I said earlier, in our practice, we've been able to expand our telehealth options during COVID-19 pandemic. And so people who are interested in meeting with me or my staff, you can request information through our website at www.drstracks.com. Our staff will get back to you with all the details that you need to know. And if you enjoyed this presentation, you can hear the recording of this and all previous episode at Curable in my Hope for Healing landing page, which is www.curablehealth.com/hope for healing. You can also sign up for our office newsletter and get updates about next episodes and everything else that's going on in our practice. And with that, we'll sign off for the evening. I wish everybody a happy and healthy new year, and we will be back in 2022. And until then, I hope everybody stays safe and healthy and has a great holiday season.
Thank you so much, Dr. Stracks.
Thank you,
It's such a
Lara. It's
pleasure.
great to see you and great to share this with you.
Thank you.
And with that, we will say good night.